I'm thrilled that this little rant that I had the other day in clinic resonated with so many of you. But I did want to clarify a few things. First and foremost, I am a family doctor. I spent 6 years as a primary care physician before I started working in menopause care. I understand the workload and the stress that's on family doctors, and I understand the utter lack of education around women's care, perimenopause, and menopause. There's a tendency in social media to really jump on a particular bandwagon and generalize from specifics. This happened to be a male doctor. However, there are so many amazing male gynecologists and family doctors out there who do take the time to learn about menopause care. And there are amazing family doctors who are great at everything that they do, but they don't know about menopause care. This is not unique to family doctors either. This happens with pharmacists all the time. It happens with specialists all the time. The issue is the fact that I, as someone who is trained in menopause care, worked really hard over 6 to 12 months with this patient to establish the dose that was optimal for her, that would prevent postmenopausal bleeding, that would manage her hot flashes, that would keep her sleeping well so that she could do her job effectively. And never in my wildest dreams as a family doctor could I have imagined receiving a discharge note from a specialist and without contacting that specialist, just arbitrarily tell the patient I was not going to do it, that they had a choice. They could give up those medications or go with what I was suggesting instead. The patient was going to be cut off from her medication entirely if she didn't go with something that she knew was not what had been working for her. There's such a tendency when it comes to menopause care specifically to just pass on fear, misinformation that you've heard along the way in your medical training. And I just know that this was not being done based on any specific thought processes. And it certainly could have done harm to the patient in the long run. Please check out some of my other content. I don't just rant and rave. I usually share easy to understand content around women's health and perimenopause.